27 months after confirming its first case of COVID-19 infection, the United States reached a soul-crushing milestone on Thursday, as its death toll crossed 1 million.
It's definitely something that has been a different situation that we've all had to deal with, and it's very surreal. It's very surreal that we are at this point where, if I see somebody who's not wearing a mask, to me it's still a little alarming, because I'm masked up everywhere I go.
The number of lives lost to COVID-19 in the US is greater than the total number of Americans killed on the battlefields of 2 world wars, the Vietnam War and the American War of Independence combined.
During the pandemic, I have seen a lot of death, a lot of tragedy. Beaumont is a small town, and we do not have a doctor in the town. So we've seen a lot of people succumb to the pandemic because we did not have the adequate resources to adhere to their sicknesses. Seeing all that tragedy just sparked or ignited the fire in me to want to be able to say, we need a doctor, we need these things. How can we get them? The pandemic just took the blinders off of us to see that how poorly we were doing.
African Americans have been disproportionately impacted by the pandemic, due to an unequal distribution of healthcare and other resources, as well as vaccine hesitancy. Some say the obvious hesitancy among the African American community toward the vaccines is partly due to Washington's notorious record of using them to conduct medical experiments.
There's a lack of trust about what the vaccine can possibly do. You can research the Tuskegee experiment that happened many years ago that, was supposed to be a study on how syphilis affected African Americans, but they basically used people as guinea pigs to figure out, let's try this experiment and see what this does. So there's a lot of distrust.